Barbiturates. Perhaps the most underestimated drugs of all are the sedatives, of which barbiturates constitute the largest group. Approximately 4,000 deaths each year can be traced to their misuse. Sedative addiction causes more deaths than all the other drugs we have already talked about put together. It is unquestionably important that you know the facts about sedatives, because your very own life may depend upon it. What are sedatives? The sedatives are a group of drugs that depress or lower the activity of your central nervous system. They have the opposite effect of the amphetamines in that they cause drowsiness rather than alertness. The two major types of sedatives are barbiturates and tranquilizers. Of these two, the barbiturates are more often abused. Since barbiturates are pills, a person who abuses them is called a pillhead. The barbiturates include phenobarbital, nembutal, seconal, amytal, and tuinal. These are the downers, and they are called by a variety of nicknames, including goofballs, barbs, candy, reds, blues, rainbows, or yellow jackets. What do barbiturates do to you? Barbiturates cause an intoxication that is very similar to alcohol. The person intoxicated on barbiturates is a pitiful sight to see. He cannot coordinate his movements. He staggers and falls all over the place. He slurs his speech and even drops food out of his mouth. He is confused, clumsy, ill-tempered, and stupid. Even other drug users consider the barbiturate user to be the lowest of all drug users. Are barbiturates addicting? Yes. Many people do not know this fact when they first start taking downers, and then find out too late that they're addicted to them and cannot get along without them. Barbiturates are physically addicting because after taking them for a while, your body begins to crave them again. If you stop taking them, painful withdrawal symptoms begin. In fact, many drug addicts claim that barbiturate withdrawal is even more painful than the dreaded heroin withdrawal. What happens during withdrawal from barbiturates? During withdrawal, the barbiturate addict experiences many extremely painful things. First, you get the shakes, which are uncontrollable muscle spasms. Then you get the fits, which are epileptic-type seizures like convulsions. You become weaker and weaker. You get dizzy and have violent fits of vomiting. You can't sleep or eat. You have nightmarish hallucinations, and in severe cases, you eventually die. This agonizing withdrawal starts a day after you stop taking barbiturates, lasts as long as 3 days, and then slowly subsides. Think about it. 72 hours of pure hell. Why do people take barbiturates? Doctors prescribe barbiturates to some patients to relieve their nervous tension and help them to sleep. The taking of barbiturates for this purpose, with discretion, is not considered dangerous. But other users take barbiturates strictly to enjoy the drunken stupor that the drug produces. Many of these people take barbiturates because the drug deadens their mind and they don't think about their problems. These are the people who are trying to escape from themselves because they are not strong enough to face the problems in their lives. Are there any other reasons why you should not take barbiturates? Besides the facts already mentioned about barbiturates, that they reduce a human being into a pitiful, slobbering idiot, that they are physically addicting and cause extremely painful withdrawal symptoms, and that they never solve any problems but only make them worse, there are still more dangers involved. First, barbiturates are an illegal drug if you do not have a prescription for their use. Second, barbiturates become a lethal poison when too many are taken. Exactly how much is too many depends on the individual. Some can take as many as 20 and still live. Others will be dead if they take only 5. If you take an overdose, or OD of downers, your only chance to remain alive is to be rushed to a hospital where your stomach will be pumped, along with many other painful measures necessary to keep you alive. Often, people will not want to take very many downers, but they become intoxicated and confused, forget how much they have taken, and then take some more, which causes them to OD. Third, many people do not know that barbiturates, when mixed with alcohol, become poisonous. Many people accidentally kill themselves by getting drunk and then taking a couple of downers, or taking downers and then drinking. Neither the alcohol nor the barbiturates by themselves would have caused death, but the combination of the two becomes a deadly poison.